this the third quarter meeting of the Rhode Island Hunger Elimination Task Force. My name is Nessa Richmond, and I am the Executive Director of the Rhode Island Food Policy Council. And for those of you who are just joining us, please introduce yourselves in the chat with your name, affiliation, and one of your favorite Rhode Island summer activities. I'm going to be reviewing the Hunger Elimination Task Force goal and then handing the meeting over to our Director of Food Strategy, Julie Stelmazik. Very excited for the agenda that she'll be sharing with you today. So the goal of the Hunger Elimination Task Force is to reduce hunger and increase access to healthy, culturally appropriate food for all Rhode Island residents. By way of a little bit of background, in October of 2017, our state agencies launched this task force, including many community partners in the conversation, and worked to address hunger and poverty for a number of years, meeting and eventually releasing a set of recommendations around eliminating hunger back in October of 2018. And these recommendations covered expanding food purchasing power, streamlining and maximizing participation in food access programs, addressing transit and transportation challenges, and other issues. And the task force itself broke into work groups to continue addressing those key issues over the next couple of years. Of course, when 2020 came and COVID hit, everyone was isolating, and the task force refocused its efforts specifically on ensuring food security and expanding food delivery access. It also greatly expanded membership to include everyone supporting the elimination of hunger in Rhode Island from all the sectors. And we now have hundreds of people who participate in these quarterly meetings, who get the Rhode Island Food Access Bulletin in order to learn and make new connections and improve their efforts to keep all Rhode Islanders food and nutrition secure. So thank you again for joining us today. When you get a chance, please introduce yourself in the chat. And I'm excited now to hand it over to our Director of Food Strategy for the state, Julie Stelmazik.
Thanks, Nessa. Hi, everyone. If we haven't met before, it's nice to meet you. I'm Julie. As we were planning for this meeting, we were concerned that we wouldn't have enough turnout because we were thinking that, people are on vacation. It's right before Labor Day, but we had over 100 of you register, and so far pretty good turnout. So I hope that means there's interest in and momentum behind our effort to develop a renewed state food vision for 2030 and build on the good work of the 2017 plan, which we called Relish Rhody, and its ripple effects from partners like you over the last 5 years. So you can see up here our agenda for the day. It's going to be a little bit more of a working session and a listening session from you. We're going to spend a little bit more time than we normally do in breakouts. And we first kind of wanted to start with a looking back, kind of reflecting on what has happened over the last 5 years as it relates to one of the 5 focus areas of the 2017 plan, which was ensuring food security for all Rhode Islanders. We also want to reflect a bit on HETF, the task force, what it was originally meant to do, what it has done over the last 5 years. And then we want to look ahead, and we want to talk about 2030 and what might be possible for us as a task force, and really surrounding this focus area that I don't think any of us imagine that going away as a focus area for the next planning process around ensuring food security and hunger elimination. So as a core stakeholder, we feel it's really important to engage you in this group. So thank you if you've participated from the beginning of this year, or even from the beginning of when the task force was established. And if it's your first time here, you're in good company. There's lots of great people on the call to meet and connect, and you'll be able to do that in the breakout rooms. So I just want to briefly share, if you don't know what the food strategy is, what I'm talking about when I say Relish Rhody and the food strategy. And these pieces. So in 2017, Rhode Island launched its first comprehensive statewide food plan. It was under the Raimondo administration, and they hired a position, the director of food strategy, and I'm the second to be in that role. You may have met Sue Anderbaugh, who was the first, and she really led planning and implementation, and I have had the privilege of continuing that since I started a little over 2 years ago. The plan was designed to be a 5-year action plan. It was a state-led plan, but it really was, its success was incumbent upon the collective impact of partners, community-based organizations, food system industry partners, etc. And it was centered around these 3 focus areas, which you can see on the right: health, access and equity, economic development, and environmental sustainability and resiliency. So this was kind of the lens that was established as the planners set out to develop the first state plan. And then it was further broken down into these 5 focus areas, which I'm not going to read. You can see them on the screen. But number 2 in particular is where the Hunger Elimination Task Force really emerged, around ensuring food security for all. Oh, it's not number 2. It's number 4. My arrow's in the wrong place. Ensuring food security for all Rhode Islanders. So after 5 years of implementation, really 6 at this point, we've had the opportunity to really begin a process of looking ahead. And so that's the stage that we're in now. And I mentioned this to this group briefly at the last meeting. But Allie, if you don't mind going to the next slide, I'll talk a little bit about the process and kind of where we are now. So the process is really led by the 3 core agency partners that I work most closely with in my role as an interagency liaison. So that's the Commerce Department, where I am based, the Department of Environmental Management, and the Department of Health. We've also established a 30-member advisory board. Some of you are on that, so thank you for continuing to serve in that capacity. And we also have spent really the last 5 or 6 months looking back. So we felt that before we could really move forward and develop new goals and objectives, that we really needed to reflect on the last 5 years. So I'm happy to share that we are almost done what we are calling the 5-year retrospective. And it's the best that we could do to measure the impact of the last 5 years. There's been significant changes in people and our food system and our world. And so we've tried to capture that as best we can within the framing of those original 5 focus areas. So that will be published, I promise, in the next 2 weeks. And we're really excited to share that with you. And shortly, you'll hear a few highlights around that number 4 focus area around food security, ensuring food security for all Rhode Islanders, and some of the findings that came out of that. As we look ahead, some of the feedback that we've received around some of the priorities that need to be front and center for 2030 are around collective impact, racial equity, and climate change. So those continue to come up as we think about priorities and directions as we look ahead. And then, how to get involved. So this task force is a really important stakeholder group that we want to engage today. And so there's a couple different ways you can get involved, but I just want to share the timeline throughout. So first, we're going to be spending this whole fall and winter really doing research, focus groups, and listening sessions. We have been able to engage a strategic planning consultant, which is Northbound Ventures. Holly Fowler is on the call today, and she'll actually be leading one of the breakout rooms today. And then we're going to spend the next 10 months really engaging stakeholders and researching relevant issues and developing goals and metrics for 2030 over the next 10 months. And the plan is to have this completed by next summer. So, next July or August, we'll have something to share. The state food plan will mean nothing without meaningful input from partners like you, businesses, industry, and communities. As they say, plans are nothing, but planning is everything. And so the process of creating this shared vision out to 2030 is just as important, if not more important, than the final document. We really want it to be active and relevant, and we don't want it to just be, some document that kind of gets old and stale and sits on a shelf. So you can stay involved. You're already connected through the Hunger Elimination Task Force, but we also have an opt-in, like a listserv that you can join. So we're going to put that in the chat right now, so you can sign up for that and get updates throughout the process. So with that, I'd like to now turn it over to Randy Belhumer with the Department of Health's Division of Community Health Equity, and my core partner around the food access work within the food strategy, to kind of do that looking back phase. So Randy, take it away.
Thanks, Julie. As Julie said, we wanted to provide everyone with some history and context around the task force, as we think it will be helpful to ground everyone in where we were sort of pre-COVID, where we are now, and then with your input, where are we going? And as Julie mentioned, ensuring food security was and is one of the 5 focus areas back in 2017. And to ensure food security, Suan Dubois launched the task force, which included members from the IFNPAC, which is the Interagency Food and Nutrition Policy Advisory Council, and many community leaders. Some of you who are here with us today, I'm sure, were involved back then. And if you're not familiar with what IFNPAC is, Max is going to put a link in the chat for you, and it was also noted in your pre-read for today as well. And so Nessa also mentioned at the beginning of our meeting today some of what I'm sharing during her opening remarks, and I want to briefly touch upon this again. So when HEFT was launched, some community partners participated alongside IFNPAC and the director of food strategy at that time. And under the director, the task force met for about a year. And in 2018, the task force presented recommendations to then Governor Raimondo, broken out into 6 sectors, which Nessa mentioned earlier. Real quick: economic development, expansion of food purchasing power, streamlining participation in existing programs, addressing transit challenges, and grounding in data to drive our decision-making, and supporting the safety net. And so the task force at that time broke into work groups to address some of these key issues. And so then fast forward to the loss of the director as we rolled into the pandemic. And so what happened at that time, again, some of you might have been involved, is IFNPAC, the governor's office, and some of you all rallied together into a work stream to address the issues of food access that were happening in the midst of the pandemic. And so then RIDO entered into a formal agreement relationship with the Food Policy Council at that time to facilitate and project manage the task force in the absence of a food strategy director, and also in the absence of our PAN program, or physical activity and nutrition program. And what became clear was the need for more robust staffing. This work stream back then really identified the need for staffing around food access and equity, around farm to school, to help to drive forward some of this work. And so RIDO successfully procured some CDC COVID funding in 21 to formally contract with the Food Policy Council to continue the management of the task force on behalf of IFNPAC and the Director of Food Strategy. And we hired our first food access and equity manager at that time. So again, we felt it important to provide this context to you along with the pre-read, in the hopes that it's helpful as we move into the breakouts. And the pre-read has been organized into topics for our breakouts. And before I turn it back over to Julie, I wanted to share with you some real high-level findings from the 5-year retrospective around ensuring food security. So real high level in 22, we launched a monthly newsletter called the FAB, the Rhode Island Food Access Bulletin, which Max can also put in the chat, to keep task force members informed of each other's work, to provide timely updates about the important policy changes and funding opportunities to make sure we're all coordinating. And so now we have about 450 people who are subscribing to the task force. And as Julie and Nessa mentioned, we typically have 50 to 100 people who attend these meetings. And then the task force, another finding from the retrospective and success was that the task force was crucial in helping the Rhode Island Foundation to conduct outreach to all eligible nonprofits for the $20 million ARPA funding that was released during the pandemic. And I believe that some of that funding is still available. Through a partnership between RIDO, Commerce, and the Food Policy Council, we've continued to increase staff capacity to support the task force and a lot of the work that we're all doing, and also to create stronger coordination on food security issues across government, industry, community organizations, individuals with lived experience. We've now grown to the point where we have a nutrition security program director, Rachel Newman Green, who many of you might know and who will introduce herself in a few minutes. And we also have our Food Access and Equity Senior Program Associate, Max DiFaria, who is also on this call with us today. This built critical capacity to support a more coordinated approach to the program's activities to improve food access and food assistance. So also another success is funding for a statewide emergency food plan that was secured. Funding was secured through the Food Policy Council, and we're working on that alongside 2.0. SNAP incentives led by the Public Health Institute and the Nourish Rhode Island campaign and others has led to a state pilot of increasing fresh fruits and veggies for SNAP recipients. It's called Eat Well, Be Well, and will be launched this fall. And we now have more data available to us through the Food Policy Council's data dashboard and also our supplemental and emergency food site map. And lastly, and not to say lastly, because there's many other successes that have come through our partners throughout these last 5 years, which you'll read about in the retrospective. RIDO launched a healthy eating and active living strategic plan from 23 to 28. Which is helping us to secure funding to reignite the HEAL program, which was formerly PAN, within our Center for Chronic Care and Disease Management. So before I turn it back over to Julie, Rachel, do you want to say a few words and welcome to the team?
Sure. Thank you so much. It's really great to be here. I think I'm seeing a lot of familiar faces, but a lot of ones that are new to me too. So I'm really excited to join you all. I have been here for just about exactly a month. It'll be day after tomorrow will be a month that I've been in the position as the program director for food access and nutrition security with the Food Policy Council. Prior to my work with the council, I was with the City of Providence for a number of years with the Healthy Communities Office, working also on food issues among every other urban health issue that was thrown at us in the past 7 years that I was in that position. With the Policy Council, I'm going to be, some of my primary work is going to be, first off, being the connection between this group and the council, which I'm really excited about. I'm diving in on the development of the state emergency food plan. So I imagine a lot of you will be reached out to, connected to somehow or other, spoken with me or others about that process that moves forward. I'm also working on the evaluation of fruit and vegetable prescription programs throughout the state to see if there's a replicable and scalable opportunities there. So I'm really excited to be working with this group. I'm really excited to be working with Max, who's the other member of my food access and nutrition security team, and looking forward to jumping into this work with you all. Thanks.
Okay, so I think that's me. I'm next, right? So we are now going to hear from you and really spend the rest of the meeting doing a listening session and trying our best to capture notes. We have 8 facilitators. Thank you again to the facilitators for saying yes to that. So just to kind of set the scene, these are some of the questions that you'll be discussing. Before I do this, I just want to share. So Randy walked us through some of the findings of the retrospective, some of the history of HETF, and then we also have all this wonderful information from many of you that have participated in these task force meetings over the last year. And so, Allie, I think we have a slide that summarizes some of that input. Yes, this is it. So just to kind of reflect back at you, this is certainly not comprehensive, but it's really high level. And we wanted to acknowledge that, we don't want to ask you the same questions that we've asked you before. And so we've tried our best to synthesize some of the feedback that you've given us around the different focus areas that the meeting has been themed around. So I just want to share at a really high level some of the things that you've told us are challenges or opportunities, gaps, or things that are working. So you can see them here. One is evaluation systems. We need better supports for evaluating food access, food security, and data around that, in addition to the growing body of knowledge that we have through the Food Policy Council's dashboard. We need strategies on reducing stigma around supplemental and nutrition food. Transportation comes up over and over. Education, another one. We need more education, food literacy, nutrition, farm to school, etc. Taking advantage of the community health workers and the robust the health equity zone network across the state seems like an untapped area. On the right, you can see some of the others here around nutrition and culturally relevant meals for older adults. Even more collaboration, while that's certainly been a focus and progress has been made, there's still a need for more collaboration at a hyper-local level and also across the state. Food delivery, better and more diverse and probably better funded food delivery options. And then food waste reduction, wasted food recovery, and solutions for institutions. So those are some of the themes that have emerged. So hopefully you can take some of the findings that Randy shared from 2017 to 2020, and then you could take some of this and help to focus the breakout groups. So what we're going to do is a little different than how we normally do this at the task force. We actually have 8 breakout groups that you are going to choose which one you join, and we really hope that this divides equally so we don't have like 40 people in one and 3 in another, but we'll see how it goes. And what I ask of all of you is to focus on this 2030 timeline, right? So typically we might do this for 2024, right? And think about what are the priorities for the next year. But as we develop our process and our priorities and our direction for the 2030 plan, we really want to hear from you about what is possible in 6 years. Where can we improve? What are the priorities that we should move towards when we talk about some of those themes around education, culturally relevant meals, transportation, etc. So we have some questions that we'll have you discuss in the group. we are online, so I certainly wanted to, I always prefer an in-person, but I think we get more turnout online. So I ask you to keep your camera on if you feel comfortable. We'll have you do some introductions and get to know the other task force members. And your facilitator will also give you a little bit of background on the area that you choose. So, Allie, do we have those 8 focus, those 8 themes for folks to choose from?
We are ready to go.
We're ready to go. Should I read them out? Yes. Okay. So they're all food access and. So food access and recovery is number 1. Number 2 is transportation and delivery. 3 is collaboration across hunger relief work. 4 is suitable meals for students and older adults. 5 is partnerships with healthcare programs. 6 is nutrition education. 7 is supplemental food and nutrition programs. And 8 is the evaluation of hunger relief programs. So those should pop up on your screen so you don't have to remember everything I just said. And it's up to you which one you want to join, hopefully one that you have experience or interest in. I think we were going to just do what we normally do, which is always an impossible task, but we try anyway, which is to just have a kind of a group discussion about some of the breakouts, and we have 8. So I'm going to ask each facilitator to share like 2 to 3 key points or takeaways from each of your breakouts. And I'm going to just start in order of my list here. So Nessa, could you go first and remind us what your focus was?
Yes, I will be very concise. So we were the food access and recovery breakout room. And I think we were the smallest group, actually. So happy to provide a little bit of what we talked about. So in terms of positives going in around food recovery, first of all, no one likes to see food go to waste. So just that general human instinct is on our side. Help with food recovery, I think, would be help. We talked about being welcome in really any setting. Second, we have a lot of organizations doing amazing food recovery work in the state and a lot of energy in our state around doing this work. And the third kind of big push was around there being collaboration on the rise. So there are a lot of organizations and they're getting to know each other. For example, the Rhode Island College Compost Conference had the biggest turnout ever the last time it was held. And there were a huge number of presenters. So our small group identified, I think, 3 major areas for growth: raising awareness and even creating incentives for doing more, whether that's on the part of institutions or businesses or residences that create food waste. Second, connecting residences, businesses, and institutions with some sort of customized support to understand what type of service can help them the most, like a clearinghouse for knowing what the resources are. Some type of mapping could be helpful for that. And then the last thing that was identified was just an area for growth being around increasing food recovery at our schools. There's a good amount of work going on there, but a lot of food wasted there, and that being a right place for there to be an area of focus for growth. That's our report out.
Thank you, Nessa. I think next was Diane.
So our group was talking about nutrition education, and we had a really lively discussion. This isn't going to be easy for me to synthesize, but we talked about the fact that the current SNAP-Ed program is really working well. It's oversubscribed, so it can't even meet all the requests and all the opportunities that it is presented with every year to actually educate people about nutrition and how to cook and all the things about healthy eating that they need to know. So we talked a little bit about train the trainer options and train the trainers in schools, for instance, elementary all the way up, train the trainers among community health workers, like opportunities to actually magnify, leverage what they do by getting that education out to more and more people who are talking and working with children, etc., and adults. So we talked a lot about that. We talked a lot about school gardens and the impact that they have and how important they are. We talked about teaching people how to catch their own fish and catch their own clams. So not just growing their own food, but the importance of being able to go out in the wild. And there is a program that one of our participants has been working in that does that. Again, it's oversubscribed. It's just so much demand for it that they could easily grow that as well if they had more resources, so that people could actually go out and clam or fish and satisfy their nutritional needs that way. So I guess the last thing I would mention is that the school itself is the learning environment, and the school meals themselves and lunch needs to be improved. That's a huge opportunity for children to learn about nutrition and own it, and there's plenty of room for improvement there as well. I'm sure I've left a bunch out. It was a great group. There were a lot of interesting ideas, but I think those are some of the highlights.
Awesome. Thank you, Diane. Randy.
So our group was the healthcare group, and what we learned is that having community health workers and nurse care managers has worked really well. CHWs really take the pressure off of practices with things like having to create whole new workflows within a clinical, like a primary care setting, and with providers, clinicians being so overwhelmed, having this conduit of a CHW or a nurse care manager checking in with patients with regards to their needs has been extremely valuable. Nurse care managers tend to do it on the acute care side. So when you have a patient who's being discharged from an acute care facility, oftentimes with an insurance company, you have access to 6 months of meals home delivered. But it's that person who's checking in to help to coordinate all of that. So it's a combination of nurse care managers and CHWs. We also talked about the concept, which many of you have heard of, as food as medicine, and working with an organization out of Massachusetts called Community Servings to also prepare medically tailored meals to deliver to patients' homes. We have a healthcare partner who is currently evaluating some of their work by looking at clinical measures such as blood pressure, weight, and hemoglobin A1C at baseline, and then again at 6 months of their program. Another big success is actually screening for social needs, which has been happening now for about 4 or 5 years. But being able to look at the screener pre and post, several months after a patient has been on, let's say, VeggieRx or home delivered, to be able to look at, are they continuing to say that they're food insecure or are they not? And also looking at biometrics like blood pressure and A1C, which is a diabetes measure, is also super helpful. Another measure of data is called the HEDIS measure, which is used in healthcare. And using that data and a third-party vendor to look at claims data and use that claims data that can be pulled to see who needs transportation, who needs a meal after being discharged from the hospital. And 2 partners who are helping to fill that need are Melanzi Catering and Papa Pals. And that has proved to be successful. I think that a lot of these are really early successes. Like we're talking programs that have maybe been in the running for like 2 to 3 years. And again, with community health workers, another accountable entity was able to increase with CHWs, families being enrolled in a produce prescription program from 29 to 60 families with the use of a CHW. And then areas that we felt like needed continued growth would be really transportation and the cost of food. You know, a lot of the health centers and primary care practices are teaching patients in areas like nutrition education, but the patient needs a food access point, and oftentimes the food access point isn't there. And of course, we have to define what we mean by food access point, but what was raised was farmers markets, you know, ability to be able to access excess produce in communities where there aren't farmers markets, perhaps. And again, food cost and delivery seems to be the biggest pain point. And that's as far as we got.
That's plenty. Thank you, Randy. Holly.
Hi, everyone. I thought I would be near the bottom of the list because of evaluation, but so with appreciation to our small but mighty group of Perla, Blaze, Callie, and Sydney, I'm not going to be as organized as Randy just was by question, but here are some of the themes that we talked about. Very different representation of organizations and groups in our room, despite only being 4 in number. And so the observation that it's not necessarily easy to know what evaluation is occurring where. And one of the thoughts was that it would be nice to have some kind of clearinghouse. This would be different from, say, the data dashboard or the food access map, but the clearinghouse of what information is being collected and tracked by many different organizations. Also, we talked about the importance of determining how evaluation will be used as part of the equation, and specifically transparent about who evaluation benefits by the process, basically. So a theme was really talking about when we do evaluation, why are we doing the evaluation, who benefits from that, how does information get shared? I would say connected to that was the comment that when there is funding for certain programs or interventions, that there be attention paid to how much of the funding is actually getting put into the actual initiative versus how much gets drawn out specifically for project management or for evaluation, and trying to keep a healthy balance in maximizing what amount of funding actually gets put into the initiative or program that eventually is getting evaluated. We talked about the importance of having not just inputs of a certain amount of money at some point for programs or evaluation, but making sure that funding is sustainable and comes from a variety of sources over time. And let's see, some of the needs or wants or thoughts were about being more intentional about integrating climate change realities into evaluation in the future. So we're talking about, it's just about the example of what it means to go and wait at a bus stop for public transportation to take you to the food access point if it is 110 degrees outside. So just incorporating some climate change realities into evaluation. And then also thinking about the qualitative with the quantitative. So not just how much food we give away, but also being able to kind of capture the impact of the difference amount of food enables. So what is a family able to focus on or do as a result of not necessarily having to worry about food? So the ripple effects basically of having access to food. curiosity about the utilization rates of food, like are the formats really working for folks as they're being delivered, and also understanding the health of food being distributed. So taking the example of a cancer patient who may not be able to utilize supplemental or emergency food sources because they can't have high sodium canned goods. So there's more, but great group. Thank you for the privilege to talk to them. And yeah, hopefully I represented what we talked about.
Thank you, Holly. That's why we have the notes. I know there's a lot more
Yep.
in there. Allison.
So in transportation delivery, I'm just going to mention 5 things to call out for this group. We noted that programs like Cartwheel and community servings are working well. However, there are limitations around the communities it can serve, whether that's geographical, like zip codes, or what they can serve. Not all of them are culturally or medically tailored meals, so the need for that. We had some great brainstorming with Rescuing Leftover Cuisines in Dana about possibly using the infrastructure they have in place for delivery for meal delivery for recipients that need it. We also talked about SNAP and ways that we could catalyze SNAP to cover the cost of delivery, whether that's even possible. The need for technology systems for organizations serving individuals and individuals receiving meal deliveries, and how important it is to have good tech platforms like an app. And then finally, the need to assess current transportation, like bus routes to meal sites and groceries stores. Do we need to add more bus stops? Do we need to change bus routes so that things are more accessible? Thanks, team.
Thank you, Allison. Rachel.
Hi. So we had a really good conversation. We were also a fairly small group. We had Karin from the Rhode Island Healthy Schools Coalition, Ken Ayers from the DEM. We had Elizabeth representing the Pawtucket Central Falls Hes, and Lisa, who's a concerned resident. And the conversation started talking about how the waivers available under COVID really made everything so much easier for families to be providing for their children, and talked about a need for increased and ongoing advocacy to make programs overall more accessible and less administratively burdensome, et cetera, for families. We had a lot of conversations about how programs that provide food to seniors and to kids are really opportunities for sort of building a foundation for good health. And one was talking about how school meals really create so many opportunities for kids to engage in the garden, which gets kids excited about fresh produce, but also is an opportunity to really teach kids and model good healthy eating. There was some conversation about how foods are often high in sodium, or if they are, even if juice is provided, that juice may not be the healthiest choice. And so making sure that the foods that are provided to kids are really communicating the right things to them about setting healthy patterns for life. There was conversations about how a lot of times programs don't provide the foods that folks need for their medical conditions or for their cultural preferences. Let's see, there's some talk about the backpack program in particular, and how that there's sort of non-standardized backpack programs to help families meet their needs over weekends or vacations, but there don't really seem to be standards set about what goes home, and that's an opportunity to really be providing better for families.
Rachel, I'm so sorry to do this. We have 2 minutes. I don't mean to cut you, but I got to switch to Max.
Okay, can I just say seniors? We also talked about the need for increased fruits and vegetables for seniors in food pantries, and making sure that folks have the knowledge and tools to actually be able to use those. And we'll jump to Max.
Thank you. Sorry to rush you. Max.
Hi, so I will be brief because we are getting up on time. So I will just highlight some of the quick things that we discussed Many of them are things that folks have already mentioned around transportation and food costs, but we specifically talked about online opportunities and continuing to expand those. So allowing WIC participants to purchase foods online and finding other ways to continue to expand online options for consulting and counseling and those kinds of things, but recognizing that it's not a perfect solution. And the other large area of conversation for us was around delivery. There are, several organizations that already do delivery really well. And so furthering community-based organization collaboration to really expand those offerings into other communities when possible, and doing that with a specific lens around nutrition programs. So I know we have 1 minute left, so I'll leave us there, but a lot of really great things came out of
Thanks,
this
Max.
conversation.
And I'm last. I'm going to do it in 30 seconds. Ready? So mine was collaboration. 5 key takeaways. One was the need for more localized and centralized communications. A lot of great work is happening at the state, but it's not always being translated to the community. 2, a desire by folks on the ground to shift from food access to food justice as a framing. 3, more coordination between service providers so that there's a more holistic experience for client referrals. And actually I had 4, not 5. Number 4 is to leverage existing models like the HES framework for community solutions and collaborations. So that's where I'll stop, and thank you all for being here. And Nessa, I'll turn it over to you to close out. And this won't be the last that you'll hear from us. Did we lose Nessa? Okay, I'm still here. Well, anyway, just want to respect your time. But thank you all for your input on this. We're going to come back to you throughout the fall and winter, and we do plan to have a statewide gathering at some point in early 2024 to really turn these things into strategies and goals and resources. So thank you all for being here, and I hope you enjoy the rest of your day. Bye-bye.